Type 2 diabetics, have you upgraded your medications? Maybe it's been a long time, you've been steady state with your primary care physician, and your A1C is decently controlled. Some of the old definitions are now out of date. So if you're like, hey, my A1C is 6.0%, I'm doing well, I don't need to make any changes to the A1C, I don't need to make any changes at all. I'm gonna tell you, I'm aggressive. Those of us on the frontier of this, we are going for normalization of that A1C. In other words, no more diabetes. That should be your goal. So there are two medications that if you are not on it and you can get it, you need to be on it if you have type 2 diabetes. One is what we call a GLP-1 receptor agonist. That is the Mounjaro, that is the Ozempic. The number 2 one is what we call a serum glucose transporter 2 inhibitor. That's your Farxiga and that's your Jardiance. Knowing how these two interact, and making sure that you eat enough to keep up with them, because they will reduce your weight, they will reduce your intake of food, they will reduce your carbohydrates in your body. So you got to make sure you know how to do it right. But if you are not on those two medications, it's time to upgrade your meds. Talk to your physician, talk to an endocrinologist, talk to an obese medicine physician who understand these meds and how beneficial they are, because they will reduce your heart attack risk, they will reduce your stroke risk, and they will probably, hopefully, reduce that A1C into the normal range. The goal nowadays is normal A1C, and there's really no reason why you can't get there. And I always say this, you gotta do your lifting. So if you've been sitting in steady state at 6.0, and if the only thing you get out of this video is do your squats, work those muscles, then please work your muscles, because that could also budget down your A1C. This is Dr. Reyes. I'll see you at the next video.